Women across America are confused when it comes to the issue of COVID shots and miscarriages. Is there a link? That's the question flagged by Anthony Fauci himself in his private text messages. And if there is a link, just how many pregnant women were affected? There are a lot of theories and a lot of stats floating around right now. So I spoke with a former CDC director, Robert Redfield, for his take. I also spoke with former deputy counsel to the president, Chad Mizell, about the legal options open to women who think they were harmed. Here's the conversation. I'm joined now by former CDC Director Dr. Robert Redfield and former Deputy Counsel to the President, Chad Mizell. Thank you both for joining us. So last night we spoke to Dr. James Thorpe, who spoke about the COVID vaccine's impact on pregnant women. Here's what he had to say.
Pfizer's own data on page 12 showed an 81% miscarriage rate. Then later on that year, April 21st, 2021, was the New England Journal of Medicine study, which was a fraudulent study. I believe it is my opinion that this was ghost written, probably by Pfizer, and it was extremely poorly written. But what the data clearly showed, Katie, was that the miscarriage rate of the raw data that they presented was an 82% miscarriage rate.
So Dr. Redfield, he's talking about the first trimester, and 82% does sound like a lot has created a debate online. But what do you make of the data that Dr. Thorpe has presented and this debate between doctors over these figures?
Well, Katie, all I can say, having looked at the New England Journal paper that came out in April, they reported 827 pregnancies in individuals that had received the COVID vaccine. And in that report, they reported 115 miscarriages or spontaneous abortions. Now, it doesn't mean that the COVID vaccine caused those because there's no control group. So you can't see what the general miscarriage rate was or spontaneous abortion rate in the population that they were doing the study in. But obviously it's disconcerting when you see a rate of almost 14% of miscarriage. I never thought we should vaccinate pregnant women. I was not in favor of that policy recommendation because the COVID vaccine did not prevent infection. So the argument that some people had that you had to vaccinate pregnant women to protect the unborn baby because it would protect mommy from getting infected. That was not a true statement because it doesn't prevent infection. And so I was of the view that the only thing the vaccine really accomplished, which was important, was it prevented serious illness and death in people that were at high risk for serious illness and death. And those are people largely over the age of 65, of which obviously that doesn't include the pregnant women population. So I think it was a mistake to vaccinate pregnant women. But I think it was more a mistake. You know, Jay Bhattacharya and I think the real mistake related to the recent text messages was that there was not an open, transparent discussion of this for the public so the public could make their own decisions about whether they thought they should take the vaccine when they were pregnant or not.
Doctor, just a follow-up on that. I mean, women, when they're pregnant, are told not to do all kinds of things, whether it's using certain cosmetic products, using things like bug spray with DEET. I mean, they're told not to do a lot of things. If the question had been posed to pregnant women, even though this was mandated for them as well, if there's a risk of a miscarriage by taking this vaccine, would you have taken it? And that's not being discussed here.
Yeah, I think you're right. I mean, we tell pregnant women not to drink a glass of wine. We tell them not to have alcohol, not to smoke cigarettes. So obviously not to take any medication that they don't know for sure is safe. So, I mean, I think it's a mistake. I think most pregnant women would elect not to be vaccinated with a vaccine that they may not see benefit. Now, there's an exception to that. I do believe vaccinating, for example, with the RSV vaccine, which was recently approved for pregnant women, I think it's kind of important because RSV has a high mortality rate in newborns. And I can't protect newborns when they're born. The only way I can protect newborns is by creating the antibody in mommy and having mommy give it to the newborn when they're born. But I would say in general, this was not a smart recommendation. And I think you're right, Katie. If you told the average person, remember this vaccine at the time was a conditionally approved vaccine. It wasn't fully approved. We didn't have a lot of data on it. It was new technology that we didn't quite understand the mRNA technology and all the potential downsides of it at the time. So I think it was an error in judgment, unfortunately. And I think, as you look at the vaccine policies that happened in the early Biden years, I think you'll see in general there was a recurrent error in judgment. One of the things, Katie, that we need to reflect on, and my wife and I unfortunately lost our first child during birth, very tragic. And you're second guessing yourself, you're third guessing yourself, you're fourth guessing yourself. The problem that all these women have is they don't really know, did I lose my baby because of this or not? I'm 100% against the protection from liability from vaccine companies. I hope Congress removes that and allows people to have the right to seek compensation. There's a lot of vaccine injury right now from the mRNA vaccines. It's about 10% of my clinical practice right now. And most of these patients have been gaslit that it couldn't have been the vaccine. No, it was the vaccine, whether it's blood clots, whether it's problems with how their blood vessels return blood to the heart, whether it's cognitive dysfunction. So there should be liability protection removed. I don't mind if the government wants to cap it, because we need a vaccine industry. I happen to be very pro-vaccine, right, but I don't think it's right that people can't seek compensation when they've been injured. And I could even argue that some of the agencies and corporations, universities, companies that mandated you had to be vaccinated in order to do your job, I think they have liability too. And the public that's been harmed should be able to seek compensation.
Yeah, Chad, haven't we seen some of that actually successfully play out with individuals suing hospitals or their place of work and winning on the grounds of being unlawfully terminated from their position, from their employment as a result of these mandates? We saw one in New York, I believe, recently.
That's right. We have seen some of these across the country. Remember this lawsuit against the U.S. military over forcing service members to get vaccinated. I think it's a slightly different question about whether if you were forced to get vaccinated and you had a miscarriage, about whether you can sue for liability. To Dr. Redfield's point, there is a tough question about causation. Is this something that would have occurred naturally? Is this something that was happened because of the vaccine? In almost every one of these instances, it's going to be really hard to tell. These are miscarriages in some instances that happened 4 years ago, 5 years ago. And so it's going to be really tough. But I do think that the United States government, I do think these vaccine manufacturers, I do think any employer that mandated this owes, first off, an apology to everybody who they impacted their lives through. And the second off, a promise that they're never going to do this again. That the sort of totalitarian system that we saw in place during COVID is gone forever, that we, the American people, recognize it, remember it, and we're not going to tolerate it anymore.
So final question, Dr. Redfield, to Chad's point about it being hard to tell in terms of the causation point of it, doesn't that just emphasize that many of these studies don't actually show the full picture of how much damage this could have done to pregnant women?
I think we don't really know, Katie. There's no doubt about it that the mRNA vaccines, particularly at the people that were not at risk for serious outcome, so that is those of us that were under 65, those under 50, children, pregnant women, I don't see any real benefit. I wish Tony had talked very openly at his recent hearing when he took the fifth more than 100 times. I understand the legal reasons that his lawyers told him to do that. But I think what the American public wanted to understand his thought process, what he did, what he now in retrospect wouldn't do, like I argued with him about the origin of the virus. It clearly came from the lab, and he clearly misdirected everybody. And if nothing else, an honest apology for the policy decisions that I made that I thought were in your best interest, but in retrospect weren't.
Chad, just real quickly, do you want to weigh in on the legal aspect of Fauci pleading the fifth 111 times, especially in light of what we learned this week about his statements potentially of this impact on pregnant women?
It's hard to imagine a justification for pleading a fifth when you've received one of the biggest, one of the most blanket, one of the most universal pardons that has ever been issued from the office of the President of the United States. And so really, I think it's a stretch. I think that Rand Paul was right to initiate contempt proceedings against him. I think fundamentally, the American people want answers. They want to know what's going on. They want the truth. Katie, like we keep being told, trust the science, and we just are asking for what's the truth? What's the data? Are masks effective? Is this safe? Do I really need it if I'm a healthy, young adult who otherwise has no underlying comorbidities or other health issues? And the fact that we refuse to still get answers from Dr. Fauci and others years after this has happened, that's the crime. That's the crime, Katie, that we need to go after.
Absolutely. And Dr. Redfield, thank you to you, because you were in the middle of all of this at the time. And the fact that you're willing to come on and talk about this in an honest way, we are so grateful for. Chad Mizell, thank you as well for the legaling of all this. Great to see you both. Thank you for joining me.
Thanks for having me.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.